I would like to invite Dr. Joseph Daniel from Nigeria. Dr. Daniel is the IHVN Program Manager, Adult and Pediatric ART in Nigeria. And today he's going to be talking about the efficiency gains from the utilization of AI-powered tools in TB and HIV program implementation in Nigeria, particularly how they've been using the EPCON platform. Dr. Daniel, the floor is yours.
All right. Thank you. My pleasure. So good afternoon, everyone. Thank you for the opportunity to present at this Delft webinar. Today, I will be sharing our experience with EPCON, an AI-powered platform that has transformed how we approach TB and HIV case finding in Nigeria. Next slide, please. So my name is Daniel Joseph. I work with IHVN as Program Manager, Technical HIV, Adult and Pediatrics HIV. Next slide. So this is IHVN, and this is our mission statement: to be a center of excellence in providing health service implementation, capacity building and research, ensuring equitable access to high quality healthcare services through innovative and evidence-based strategies. Of course, this aligns with the mandate given to IHVN by the Global Fund to reach all vulnerable populations, pregnant women, adolescent girls and young women, pediatrics, and even KPs, including men who have sex with men, female sexual workers, and other in enclosed settings. Next slide, please. So IHVN currently implements the GC7 grant, which is a combined TB and HIV effort. IHVN is a current principal recipient on this grant, which has lasted from 2024 and will end in by 2026. IHVN implements a nationwide coverage to TB, community TB testing, as well as the mother-to-child transmission, where it's expected to provide HIV testing services to 5.3 pregnant women and link about 42,000 pregnant women to treatment. Next slide, please. In our implementation, we work with 11 sub-recipients on the grant, and in coordination with the national programs we implement across the 36+1 states in Nigeria using these sub-recipients, where we implement TB, as well as PMTCT services across the 36+1 states, and in 4 states of Anambra, Gombe, Kwara, and Ebonyi states, we implement comprehensive HIV services across these 4 states. Next slide, please. So in the next I'll be discussing the outline for this presentation, which will begin with the challenges as well as IHVN's innovative solutions to these challenges. We'll talk about the EPCON platform, evidence from the field, the impact of the scale of implementation, as well as lessons and future priorities for IHVN. Next slide, please. So Nigeria faces a high dual burden of TB and HIV amidst malaria and other non-communicable diseases. Pregnant women, pediatrics, and adolescent girls are disproportionately affected. Our programs are constrained by 3 key challenges of inaccessible communities, limited resources, as well as delayed data insights. Can AI be a transformative lever to overcome these challenges and reach underserved communities? Our answer is yes. How are we doing this? The Institute of Human Virology of Nigeria is leveraging the EPCON AI and has demonstrated substantial gains in the Global Fund GC7 grant in Nigeria. Next slide. So what is EPCON? It is an AI-enhanced early warning and epidemiological surveillance platform that has been used by IHVN to predict using demographic and geographic health data of the population, where it generates testing codes that predict underserved high burden areas in the country. This is done up to the ward level, enabling proactive and targeted testing to be done across communities for TB and HIV case findings. The graph you see below is a heat map showing areas with high prevalence as well as high burden of specified diseases, especially HIV and TB cases, up to the ward level. At the upper right corner, you will see the enhanced heat map showing areas that are areas of vulnerability where our healthcare workers can find tree of screen. So in implementation, EPCON has helped us to do a lot of hotspot prediction, helping us in identifying vulnerable populations at their local basis in the community. It has also enabled healthcare workers to be guided to specific areas for testing, and also provides real-time reporting in the community. This platform has also enabled us to integrate our HIV and TB surveillance in one single platform, therefore further enhancing integration. In the next slide, we'll talk about how EPCON works through a four-stage approach. Next slide, please. So EPCON does this by integrating data that is fed to read from our national platform, the DHIS2, and also generates data from the epidemiological as well as data from the population. This is integrated into the platform, and the platform does a prediction using machine learning algorithms that analyze patterns and generates these codes from high burden hotspots. This is now fed to given to community health workers and ad hoc staffs in our programs, who then go into the community using guided Google Maps to find these vulnerable populations at their communities. In these places, targeted screening is then done for these populations that are found. Next slide, please. The process of doing this is actually very straightforward. This data is fed into the EPCON platform, which uses AIs to generate these hotspots that predicts where the vulnerable populations can be found by these ad hoc staffs, and they go there to do the testing So looking at the national picture and works that have been done by different SROs on the program, we will see that the number of pregnant women screened has increased by sixfold, from 64,000 to approximately 428,000 pregnant women screened within a 6 months period in the introduction of the EPCON platform. It has also dramatically increased our presumptive to case ratio, dropping it from 74:1 to 19:1. This actually means that the number needed to screen and test a positive case had drastically dropped from 74 to 19 presumptive cases to one TB case. EPCON has also helped in ensuring that our TB case yield has improved 5% compared to the 1% we were previously having using conventional testing methods, where healthcare workers go into the community unaided and test using their intuition. Next slide. In the next slide, we'll look at TB case finding in pregnant women from a pre-intervention and a post-intervention using the EPCON platform. With this, we'll see that there has been a 34-fold relative improvement in TB case confirmation. We did a statistical analysis on this at a p-value of 0.01, showing evidence that EPCON has really improved our performance in TB case finding in pregnant women. The pregnant women that were identified within this period, a period of 2024, when EPCON was not in use, was about 1,543 pregnant women. Compared to when EPCON was used in 2025, we had 89,053 pregnant women who were identified in the community. Of that number of 50,000 pregnant women identified without the aid of EPCON, 47,601 were screened for TB. In comparison to when EPCON was used, we screened about 86,243 pregnant women. Of this number, without the aid of EPCON, only 1,434 presumptive TB cases were identified in the pre-intervention phase. But with EPCON, we were able to find 5,120 presumptive cases. By the end of 2024, only 2 cases, confirmed TB cases, were identified without the aid of EPCON. But when EPCON was utilized in our intervention, we had 277 confirmed TB cases. This translates into a 74.5% pregnant women identification rate, 81.2% screening rate, and the presumptive TB cases that were identified using EPCON rose to 257%. And while confirmed TB cases showed that there was about 13,750% improvement using the EPCON AI application. Next slide, please. In the next slide, we'll talk about AI-powered portable digital X-ray screening using AI-powered applications in the community. This has aided us in improving our adult and childhood TB cases in the community. And coming from the different states of implementation in Nigeria, we have seen very remarkable improvement in our TB case finding. In Katsina State, about 59,907 individuals were screened across 24 LGAs. Of this number, 49,920 were screened using the ComTB app and 9,900 through the PDX machine, which is also an AI cut tool. 2,244 TB cases were confirmed in total from this intervention. Of this number, about 1,695 were confirmed using the ComTB app, yielding a 3% gain. But that which was done using the PDX with the CAT for TB, which is an AI-powered tool, we had an increase of 5.5%, yielding about 549 TB cases that were confirmed compared to the symptom screening that was done using ComTB, which was at 3%. This shows that EPCON improved our performance by 38%, giving us an efficiency gain way beyond the conventional method of TB screening. So that also improved our number needed to test from 29 to 18. In Bauchi State, similarly, an intervention that was done using this screening tool showed that 14,671 individuals were reached in the community using an outreach method. 3,270 presumptives were identified in the community. Of this number, 457 TB cases were diagnosed. 78 were bacteriological diagnoses, 379 were clinical diagnoses. With the AI assisted tool, the TB yield rose to 14%, and clinical diagnosis showed that 83% of the detected cases found using AI PDX, identifying more cases than the conventional. So while conventional screening relies on the WHO four symptom guide, AI-aided PDX improves efficiencies by improving the numbers that are screened, as well as the screening efficiencies and outcomes from these interventions. Next slide, please. In our PMTCT program, EPCON has been shown to outpace maternal HIV transmission in Katsina. This was seen in some interventions that were done in Katsina by Frank and others, by KNCV. Results emanating from this shows that hotspot detection using EPCON improved screening by 6 weeks earlier compared to conventional testing, which was just a reactive model of testing. The sensitivity emanating from EPCON showed that EPCON was 0.88 or 88% sensitivity compared to 64% sensitivity using conventional methods, which were community healthcare workers just identifying areas to go and do screening. The positive predictive value emanating from the use of EPCON shows that the PPV was 62% compared to only 41% using conventional method. Also, EPCON has aided the prediction of hotspots across the 36 LGAs in this state. Then pregnant women that were reached using EPCON compared to the conventional method shows that 2,109 pregnant women were reached in these LGAs within a space of 3 months compared to the conventional methods, which are facility-based and reactive, allowing pregnant women to approach the facilities before they are tested. This shows that EPCON is both proactive and predictive in our implementation, enabling us to have more efficiency gains in our PMTCT program. Next slide. In reaching our adolescent girls and young women, where we also utilize the EPCON platform, we have seen very significant gains utilizing the EPCON platform on our AGYW program. Prior to the implementation of EPCON on our program, we were lagging behind in the AGYW implementation because we were unable to reach this targeted but vulnerable population. So some of the studies we conducted using the EPCON and comparing it with our pre-implementation where EPCON was not utilized shows that AGYW reached with preventive interventions were just 4,180 compared to the use and utilization of EPCON, where this number and figure rose to 41,291. In comparison to AGYW that were tested without EPCON were 3,646. As compared to the utilization of EPCON, we are able to test 21,528 in adolescent girls and young women within a space of 3 months in 2025 when EPCON was fully utilized on our program. So what does this translate into? This shows that 887.8% increase in AGYW reach using EPCON was seen on our program. And also, EPCON helped increase the AGYW that were tested for HIV from 1,646 to 21,528, giving us a whopping 490.5% achievement. Next slide. Consolidating the gains that we have gotten from the use of EPCON from this selected but representative evidence. When we look at across all the 5 studies that were done, we see that there is consistent evidence that the use of EPCON is better than conventional testing. Therefore, EPCON delivers better coverage, better yield, and better efficiency. These numbers represent real lives, real women, real families who have been reached and would have been missed using our conventional and reactive approaches. So for the pregnant women screen nationwide, we have seen that on average, semesterly, we have seen 428,958 pregnant women being screened. And we have had 774 LGAs in Nigeria currently being covered. That's to say the entire country is now covered. Compared to our conventional screening, we just allowed the healthcare workers to use their intuition to approach this vulnerable population, therefore having missed opportunities in these communities. For the TB cases that have been found, we have increased by 5% positivity. Also, there has been a TB confirmation improvement of 38 times the conventional testing. And also, EPCON is able, on average, to predict hotspot detection by 6 weeks, and also has helped improve our ANC linkage rate from 92 to 95% to about 100% currently. Apart from what we see on the fee, we also have operational efficiency gains. Next slide, please. On our program, with the use of EPCON, there has been some reduction in monthly program review time because these things are done real time on the platform. The app predicts where healthcare workers should go to, and therefore saves time as well as resources on the program. For our reporting compliance, when healthcare workers go into the field, reporting is always done. Real time, EPCON has helped in improving this reporting from the field, and also serves as evidence that work was done in communities because it is real time, and the platform enables us to also identify hotspots that have been visited historically. So it has also helped us to improve capacity building because for these healthcare workers who work in the communities, they are able to be taught on real time, as well as there is mentorship and capacity building for them to understand the platform and also be able to utilize the platform in getting efficiencies across board. Next slide. For the lessons learned for the sustainable screening programs that IHVN has recorded, and we are also advocating this to be implemented in other countries, we understood that integrating AI into existing systems is a way to go. Therefore, countries can leverage existing data systems rather than building parallel one. As you see, EPCON is linked to the Nigerian DHIS2 platform, which sieves existing epidemiological data for the country and uses it to make predictions for the program. So also, we can start with hotspot precision rather than mass screening. As Global Fund, we move into the GC8 grant, it is expected that we do more with little, and therefore, instead of screening so much using the conventional approaches, it is even better to look at efficiencies and effectiveness using AI-powered tools which can make prediction and leave us with some efficiencies gains. So it is also good to combine AI prediction with community mobilization. As you know, technology alone is not sufficient. Therefore, the success of the EPCON platform depends on trained community healthcare workers who are able to translate this into usable predictions. And our healthcare workers in the field continue to undergo capacity building for using this platform to make informed decisions in community. So it is also good to measure efficiencies on the platform. As we see, EPCON enabled us to reduce our presumptive to case ratio from 74:1 to 19:1. Therefore, in looking at efficiencies on our programs, we'll need to use AI-powered tools that can help us save resources as well as manpower time. Also, one of the lessons we have learned here is that the use of EPCON has also helped us to integrate our HIV TB program. Therefore, we can look at our TB and HIV program in one platform that helps us predict disease patterns as well as areas of vulnerability on what platform. What are the future priorities for us using AI in our intervention? Next slide, please. So with the emerging field of predicting TB implementation science, what future priorities are we looking at? For IHVN, we have moved a step further to begin to look at areas where AI can be used in hyper-personalized interventions, where we can use AI to segment populations and tailor our messages as well as our intervention and services to suit our clients' risk patterns. So this is particularly important in our AGYW and PMTCT program, where these are key vulnerable populations that we are looking at. So we have also attempted to move from being reactive to proactive and predictive in our programs. The use of AI has allowed us to better approach our programming in the sense that we are able to think ahead of time, where we can find a larger population and where the risk patterns are more to find cases. So we are also looking at important areas in our service delivery, which include decentralized service delivery for our clients. Decentralized self-service involves leveraging AI for client-centered services that include HIV self-testing distribution. With AI, we are able to better predict where we can see hotspots, where we can see this vulnerable population, and better tailor our services. Therefore, in the implementation of our HIV self-testing program, we can better predict hotspots where we can see this vulnerable population and then distribute our HIV test kits in those areas. This is also particularly important in our NSP program, needle and syringe program, as well as the medication-assisted therapy programs, where we can find this vulnerable population through AI prediction. We have also moved on from a manual way of programming onto an autonomous health system approach, where we can build AI recommended actions as well as automated routines, creating a self-reliant program that continuously improve. In conclusion, next slide. Our evidence proves that EPCON is a foundational enhancer of efficiency in public health. It offers a scalable, replicable model for other countries. For those preparing for GC8 and other large countrywide public health programs, the message is very clear. Invest in AI-driven screening platforms. They work because you will reach more people, optimize efficiency, and you will save more lives. Thank you very much. IHVN and its partners have no personal financial interest in the commercial success of EPCON app. Our interest is solely in their public health impact and the testimony of our use cases and successes in the field. This is an acknowledgement to all our implementing partners, our funders, and particularly the government of Nigeria. Thank you very much.